Thanks for staying with us right here on Sunrise as we continue this Hope Day Wednesday. Now, the city of Johannesburg will start an emergency measles vaccination campaign to prevent the spread of the highly contagious disease, which is a leading cause of death amongst babies and teenagers. Now, the campaign will start on Monday, the 15th, and run until Friday, the 30th of June. Now, the campaign follows a directive from the Department of Health after a reported increase in the number of confirmed measles cases in Gauteng. Now, the department has detected at least 17 cases in Johannesburg, the Tshwane Metro, and in Ekurhuleni. To talk more to us about that, of course, we're joined by Dr. Marlin Mckay. And you at home can be part of our discussion by giving us a call on 01144471742 or 1620. Good morning to you, Doctor, and thanks for joining us.
Thank you, Penny.
So now let's just get a deeper understanding on the measles. How serious is it and what exactly is it?
Okay, so measles is probably one of the most deadly, serious, contagious viral infections that affect kids, and it's one of the causes of death. The rate of death is quite high amongst kids who become infected with measles. And the bottom line is that measles is totally preventable. We have a safe, effective vaccine. And every now and again we have these outbreaks of measles, and in this case my understanding is that it's as a result of people who are not vaccinated. I mean, here's a vaccine that is provided free of charge by the Department of Health, is safe, effective, and can prevent measles. And so, and what makes it so contagious is that it's spread by droplet spread and contact, direct contact. So it's viral borne, it's airborne. You cough it, you sneeze it out, can be on surfaces, remains viable for up to 2 hours in the air, and it can cause outbreaks. It can spread throughout a whole school, throughout the workplace. And so whenever there's an outbreak of this nature, 17 cases is a lot for such a short period of time. Usually you have just a few within a whole calendar year. So this is serious. It has to be taken seriously and can have devastating consequences for communities. Okay,
so let's talk about the symptoms to the naked eye so that people who are within these areas that have been mentioned can be able to do something if they can.
So the kids will generally present with a high fever, can be red eyes, runny nose, sniffy, snotty. And then after a few days, you get this rash that appears. And it's a fine red rash. We talk about a maculopapular rash, which can spread start on the head and the face, and then rapidly move down to the whole body. And then if it's not recognized immediately, or if there's no vaccine, the kids can then have complications. And these complications are devastating, can lead to blindness, can lead to encephalitis, which is inflammation on the membranes around the brain, brain swelling, and complications from there, dehydration and pneumonia and death. So, and the difficult part of it is that it's actually contagious from a few days before the rash starts. So you may not even know that it's measles. We make the diagnosis usually on the appearance of the rash and some white spots in the mouth. And that can make it quite tricky.
Okay, what does it mean to be exposed to measles?
Okay, so if for instance you have measles and I come into contact with you and we exchange body fluids, for instance, so if you cough or sneeze and I inhale that, I'm immediately exposed. But I'm not immediately infectious. I don't get sick immediately. We then talk about the incubation period. So the incubation period is the time from the time that I get exposed to measles, to you, up until the time I start getting ill. So that's about 10 to 14 days. And then you start getting the headache, the fever, the rash, watery eyes, red eyes, coughing, spluttering, and then the rash starts after that.
So now let's talk about the vaccination. There's people who are concerned about the MMR vaccines in terms of risks and all of that. What are those risks?
Okay, so remember the vaccine is safe. In a few years ago, there's an outcry about there's mercury and thiouresyl in these vaccines. These vaccines do not have this. It's a live attenuated vaccine. It's safe. The only time you cannot use it is maybe if you have a pyrexia illness, if you're feverish at that time, if you're allergic to things like neomycin or gelatine, you can't have it. But there are no contraindications. And of course, there was at some stage in the literature some concern that it may have been linked to autism. Subsequently, it has been found through numerous studies, and even the original study that tried to show that was shown to be false. So there's no link between the measles vaccine and any illnesses, any diseases amongst children. So for that, for all intents and purposes, it's safe.
Okay, so we're currently dealing with an outbreak, which obviously the government is trying to fast track. But for parents, what can I do now? Can I check if my child has been vaccinated for measles and get them? What are the things that I can do?
So basically, according to the immunization schedule that we have from the Department of Health, all our kids routinely would have been vaccinated against measles at 9 months and then a booster at about 18 months. So you just have to check your clinic card, the Road to Health chart. You have an immunization schedule and you can see on that. However, with this outbreak, we are encouraging every single child, irrespective of whether they have been vaccinated already, to please get revaccinated, to boost what you call herd immunity. So we want more people and to boost their numbers that are vaccinated so that we can prevent further outbreaks. And this is what the drive is.
So a revaccination is encouraged for
everyone. Is encouraged from the age of 5 right up until about 15, and I think even younger from the news bulletin. So everybody, irrespective, we trying to cover as many people as possible, irrespective of whether you have already been vaccinated. Please get one booster again.
Okay. All right. So we're going to take a few questions from our Facebook page, Doctor, this morning, because when we have you here, our viewers always want to take advantage and ask some questions. Lesego says, I have period pains problem. It does not go away every month. I've been to gynaes and they don't see anything. The pain is unbearable. I am 30 and have one child, and I was even thinking of taking out my womb. The pain is really killing me. What can I do?
So I wouldn't be so drastic as to recommend a hysterectomy, but they are, even though the gynae may not find anything wrong, dysmenorrhea is part of periods, and some women get it more severely than others. But there are very good medications that can help. Oral contraceptive pills can help, and anti-inflammatories are probably a gold standard of treatment of that. So let your GP recommend a range of anti-inflammatories. You can try some over a few months, and you will find one that helps you to eradicate it or at least keep it under control. Okay.
Now, Romeo Masia saying, is eating raw chili and pepper bad for my health, and how?
Well, it depends on volume. Obviously, if you're using it as your main meal or the copious amounts of it, it can be detrimental. In small doses, adding with food, it's got good it's good source of antioxidants. So there's nothing wrong with that. But it depends on why you're taking it and how much are you taking.
Okay, fine. So, Kile, can you get HIV when you don't have a scratch on your penis?
When you don't have a scratch? Well, so HIV is about contact with bodily fluids and sexual fluids in particular. So if you're indulging in unprotected or condomless sex with someone who is positive, whether or not you have a scratch on your penis, you are at risk of getting HIV. The scratch or the open wound or an STI will just increase that risk. But there's a risk even on a normal penis.
Okay. All right. So as we wrap up, Dr. Marlin Mckay, the question is, do you ever repeat ties? That's a question.
Never.
Never.
I have enough to keep us going for years.
There you have it for those of you who wanted to know. Of course, that was Dr. Marlin Mckay talking to us about the prevalence of measles. So you heard, please go revaccinate.